Welcome to Zenith Medical and Kidney Center, which is also an ISN-approved interventional nephrology training center. I am Dr. Thelma, the Director of Hospital Management and the Public Health Physician. Thank you for choosing our center for your various medical services, especially kidney transplantation. Zenith Medical and Kidney Center is a multi-specialist center and the largest kidney transplant center in West Africa. It is located in the heart of the capital city, Abuja, Nigeria, where we have an active and self-sustainable kidney transplant program performing an average of 10 kidney transplants monthly. We use living donors for our kidney transplantation program, as Nigerians do not yet have a policy that supports cadaveric organ donation. It's important to note that all our recipients and living donors go through various levels of pre-transplant education and counseling called pre-tech, pre-transplant testing and checklist certification, as well as a thorough legal process and financial counseling in a bid to prepare them for the journey ahead and certify them medically fit, mentally fit, legally fit, and financially ready. In addition, because of our tremendous growth and success over the years in our transplant program, by April 2022, we would have completed our 300-bedded transplant complex for our kidney and liver transplant program to accommodate the growing population in Nigeria, as well as the growth demand of the patients seeking our services from other parts of the globe. Finally, during the course of this video, various team members will talk you through the process of kidney transplant to help make the process as seamless as possible. Once again, thank you for choosing Zenith Medical and Kidney Center, a multi-specialist and a one-stop center for all your health care requirements.
Good day, everyone. My name is Dr. Latishe Olalekon. I'm a consultant nephrologist and the CEO and the medical director of Zenith Medical and Kidney Center. Today's video will be talking to you about kidney transplantation, the benefits, the risk, and of course what you need to know, what you need to do to have a successful kidney transplantation. The transplant program in Zenith Medical and Kidney Center is about 6 years old, and we have a team of highly trained professionals, nephrologists, surgeons, dietitians, anesthetists, and we're taking you through the process so that we inform you on the things you need to know about kidney transplantation. Now, like I said, the program is about 6 years old, and we've done over 500 transplants. Today, I will educate you about what you need to know concerning kidney transplantation. First of all, you should know that kidney transplantation on its own is a form of treatment and not a cure. Just the same way dialysis is a treatment modality. But all over the world, we all know that kidney transplant is a preferred treatment option. And so it comes with its own benefits and risk. Now, what are the things that you need to know? First of all, a kidney is taken from a donor and surgically placed in you, the recipient. And then, of course, there are issues with your body your immunity trying to reject the kidneys. So rejection is one of the things that we do encounter in kidney transplant. The other things that you need to worry about is the fact that you could have clots, you could bleeding after surgery. But these are all rare complications, and so but it's important that you know about them. Now, what are the benefits? There are so many. One is that the quality of life improves as against remaining on dialysis. Then long-term outcomes. Patients who have had kidney transplant tend to live longer than those ones on dialysis. That's 2. Then 3 is the fact that it will be easier for you to travel to any part of the world and not getting to think about, do they have dialysis centers where you're going to? For women of childbearing age, improved fertility, then less restriction on diet. You don't have to, while you're on dialysis, we tell you restrict fluid, we restrict food, various types of food that you cannot have. But with transplant, you are at liberty to eat, So these are all, and of course, it's also cheaper on the long run. So these are all the benefits of kidney transplantation. Now, we will also look at what are the things that you need to do to have a successful transplant. This will include you listening to other colleagues of mine concerning the video, the fact that you need to go on immunosuppressants after the transplant is very important. These drugs are the ones that will help prevent your body from rejecting the kidneys, and so you need to know about them. And then again, every drug has its own side effects. They also have their side effects. It increases your risk of infection, risk of having malignancies are also increased. And the totality of it is that you need to take these drugs, and so you need to know about immunosuppressants after transplant. And then of course you need to take enough water, you rehydrate from time to time. These are all the things that you need to know concerning kidney transplant.
Hi, I'm Rashida Tamin, the Transplant Liaison Officer here at Zenith Medical and Kidney Center. We appreciate you for choosing us to help you with the required treatment. I'll be giving you information regarding pre-transplant evaluation processes up until your post-transplant. I'll also be guiding you from when you come into the hospital in case you need inquiries regarding transplant and till your post-transplant. Today I'll be giving you information about what you expect in the ICU, ward, feeding, medications, and the infection control protocol. When kidney transplant has been prescribed as the right treatment for you and you're set for transplant, with a mindset to be fully committed to proper medications, abstaining from anything that will be of damage to the kidney, the regular checkups a month after transplant, and finally, financially fit to cater for the transplant and post-transplant expenses, either personally or through social support. As soon as you have the mindset for all of these factors, you'll be meeting our consultants from a nephrologist, urologist, anesthetist, surgeon to explain to you what you should expect during transplant and post-transplant. You'll also be undergoing pre-evaluation tests, which include lab tests to check for infections, blood group, and some radiology investigations, or to check if you and your prospective voluntary donor are medically fit and physically fit for the kidney transplant surgery. Then you'll also be undergoing the immunological evaluation tests, which are the HLA, DSA, and cross-match. These tests are done all in preparation to avoid post-transplant complications. And if the results are favorable, you'll be finally subjected to legal approval from the hospital legal department prior to your surgery. If not, you'll be included on the waiting list to match you with a donor on the pool. Post-transplant care is high priority, which is why we usually transfer you to the intensive care unit to thoroughly monitor you for any sign of rejection, infection, or any other complications. The average hospital stay is about 7 to 14 days post-transplant. It might take more than that. It depends on if there's any complications, which we hope you don't have. You'll be started on some medications immediately after the surgery in order to suppress your immune system. And some of these medications are continued on a lifetime basis. We are so keen on preventing contact transfer, directly or indirectly, so we don't allow relatives into the ICU. You can always talk with your relative by staying at the glass wall. Feeding is a very important healthy lifestyle. A dietitian can help you make the right healthy food choices for a healthy lifestyle. Here at Zenith Medical and Kidney Center, we have a restaurant in which our dietitian can easily work with to give you that feeling of wellness. Even though you financially budgeted for the whole process, you need to be fully ready for the cost of transplant, the evaluation test, medications, healthy feeding, and regular checkups post-transplant. Some private and state insurers have some coverage to relieve the financial burden, and also you'll be guided at every stage of the process. Thank you for choosing us again. I'll be here to answer any of your questions, or I can guide you to a professional here at Zenith Medical and Kidney Center to answer your questions.
My name is Dr. Ilela Fauzia, and I'm one of your transplant coordinators here at Zenith Medical and Kidney Center. So here in ZMKC, we have a transplant workup checklist that was made specifically for our patients to help you navigate your way through the workup process. Now on this checklist, you'll find from the beginning to the end of your transplant, all the departments that you are going to go through and all the people that you will need to see to make your transplant workup process easy. So starting from the front desk, where they will direct you to see a doctor in the outpatient department, where they will take your history and send you to do a series of investigations to make sure that you are fit for your transplant surgery. You will also need to see the surgeon, the nephrologist, the anesthetist who will be putting you to sleep for your surgery, and also go through the legal department, where you'll be declaring that you and your donor are going through this transplant process at their own free will. So this transplant workup checklist is extremely important, as you will not be admitted for your transplant without completing this process. At each point of your transplant workup, someone will sign on your paper, and this will have to be presented at the end when you are called in for your admission. Please make sure you are with it at all times. Do not lose this paper, because this is basically your visa to go through your transplant process here in ZMKC. So here in ZMKC, we have a world-recognized program called the Paired Donor Exchange Program. This is done worldwide to help ease the process of transplant for some patients. Although we do advocate, however, we are aware that some patients might not have relatives who are fit to undergo this transplant donation process. The pairing of a recipient with a donor is another option when done if you are not a match with your voluntary donor. Paired kidney exchange can be done between two pairs of people or more, whereby donor 1 can give to recipient 2 and donor 2 can give to recipient 1. Or in some cases, donor 2 might be giving to recipient 3. We cannot tell how long this process might take, as this will solely depend on your investigation results, such as your HLA and your blood group. So some people might end up waiting for a few days before they find a match, and for some, however, it may take up to months. So please be patient with us during this waiting process, as we assure you that we are trying to do our best to make sure you have a best match kidney. After being matched with your new donor through our Paired Donor Exchange program, you will still need to repeat a few of your investigations. First one might be for your donor, depending on how long this donor has been in the pool, as things may change on a daily. Secondly, you will still need to do a cross-match test, because a test needs to be done to know that whether your body will reject the kidney from your new paired donor. If it is a match, you will go ahead with your transplant process as planned, and if it is not, we will still go ahead and try to match you with another donor on the pool. So even after we've informed you that you are a match with your donor, there's still a possibility you might go through what is called a plasmapheresis session. Depending on the antibodies that showed up on your investigation that was done, you might need to go through some process to remove some of these antibodies to give you a better chance of your body receiving this new kidney. And you will be informed. This is not for every patient, but you might be one of them. And sessions might vary. You might need to do 1 session, 2 sessions, or 3 sessions. You will be duly informed if you are one of the patients that will be needing the plasma exchange session before you are set for your transplant date.
I'm Dr. Adegboye Gafakpanle, consultant nephrologist, transplant nephrologist here at Zenith Medical and Kidney Center. Advances in surgery and care now allow people to donate a kidney to help their friends, relatives, or even strangers who are in need of transplant. Advantages of a kidney transplant include: 1. Increases the number of organs available for patients on the transplant wait list, little or no wait time, there's quicker recovery time for kidney recipients, better long-term outcomes for kidney transplant recipients, the additional benefits of knowing that they've contributed to another person's life in a very meaningful way. Kidney transplant is the treatment of choice for suitable candidates in end-stage renal disease, conferring a survival advantage over remaining on dialysis across all age groups. Though there's no consensus on the upper limits as a sensible biologic limit for donation, but we at Zenith Medical and Kidney Center, we take 75 years as a sensible biologic limit, and suitability is assessed on a case-to-case basis. Routine assessment of a kidney transplant candidate includes a thorough history and physical examination, psychosocial examination, and a psychiatric evaluation. The laboratory evaluation includes complete blood analysis, screening for bacterial, fungal, viruses, cardiac evaluation, imaging, and then colonoscopy for patients who are older than 60, and then pap smear for female patients. And then again, we also run the immunologic test, complete immunologic test, including what they call the human leukocyte antigen test, the cross-match, and the donor-specific antibody testing. May I at this point add that at Zenith Medical and Kidney Center, we provide flowcharts, a procedural flowcharts for all our patients, for both donors and recipients. This ensures that the full investigations are all carried out and that all the specialists involved are on board with the patient's procedure. For living donors evaluation, options include living-related donors, living-unrelated donors, and then the kidney paired donation. Kidney paired donation occurs when an incompatible donor and recipient is swapped or exchanged with another incompatible pair who are medically suitable. At Zenith Medical and Kidney Center, there are guidelines as to what the absolute and relative contraindications should be, and these are in sync with our national guidelines and also reputable international transplant bodies. After all these tests, compatible donors and recipients are informed and they are presented at the multidisciplinary team meetings, which will always hold the week preceding transplants, and where all the summaries of all the patients, including all the workup investigations that have been carried out, are presented. Whatever concerns noted at that meeting are quickly addressed before the proposed or set day of transplant.
Hello, I'm Adam Muchibo, a laboratory physician and director of the molecular lab here at ZMKC. There are a series of investigations you would have to do to receive a renal transplant. This will form the core component of your clinical evaluation here at ZMKC. On contact with us, we'll take some tissue samples from you, specifically blood, and run some tests on them. This will give us the ability to, for starters, determine the baseline state of health, as well as any chronic disorder you may have, such as hypertension, diabetes, or any chronic kidney disease. Once that is done, we'll also check for some infections as well as do a drug screen. Then finally, we'll do the immunologic workup. Now that's just to see how compatible you are as a recipient with your prospective donor. There are three major components in this immunologic workup. One is the human leukocyte antigen typing, known as the HLA typing. They're just basically proteins that help us fight infections. Secondly, a donor-specific antibody screening, DSA. Now, antibodies, which are also part of the immune system, are important, but these particular ones have a tendency of affecting the donated kidney. Then lastly, the tissue cross-match. Here, we take the serum, which is a component of your blood, and mix it with some lymphocytes or some cells from the donor and see if they are compatible or if there's any reaction. Think of it as a mini surgery before the main surgery. Now, with the acquisition of the latest Luminex detection system, known as the LabScan 3D, and its accompanying two softwares, the HLA typing as well as the antibody screening is done here in ZMKC. Also, we have the latest broad-based digital fluorescent microscope that allows us to carry out the tissue transplant as well as the cross-match anytime in-house here at ZMKC. Even after a successful transplant, you will still have contact with us here at the laboratory. Because for one, we will still need to follow up the transplanted kidney by checking out the renal function, as well as checking for infections, and finally, to monitor the antibodies level as well as the drugs we will give you.
This is Radiology Department of Zenith Medical and Kidney Center. I am Dr. Donald Obialo-Ibe, one of the radiologists here in Zenith Medical and Kidney Center. So during your pre-transplant evaluation, you and your donor will be undergoing a number of imaging modalities that will actually assist you during the pre-transplant evaluation. We, the radiologists, and our excellent imaging technologists, that's our radiographers, will ensure a speedy and seamless service delivery. So for the recipient, we are going to do a chest x-ray. The chest x-ray will assess the state of the lungs because you are going to undergo anesthesia. The second examination is a Doppler ultrasound of the abdominal aorta and the iliac vessels, and this will assess the patency of the iliac vessels. The third investigation will be an echocardiography. Echocardiography will look at the heart, check for the cardiac function, and also check for any structural abnormality within the heart. The fourth one is the abdominopelvic ultrasound scan, which will look for at the liver, the spleen, the pancreas to check for any underlying pathology that we may miss out. So for the donor is also going to do a chest x-ray because he's also going to undergo anesthesia for the surgery. So you are looking for any underlying lung pathology. Then there's a CT renal angiogram, which assesses the patency of the renal vessels and also the caliber and the kidney, the parenchyma of the kidney. That's what the CT will be used for. So, and that's the renal angiogram is going to be the one of the kidneys, and we check for which kidney will be used for the transplant. The third investigation for the donor is the echocardiography. So the echocardiography is going to check for the heart function, and it's also check for any underlying cardiac abnormality. Then the last is the abdominopelvic ultrasound scan. Just like the recipient, we are also going to assess whether there is any structural abnormality with the internal organs of the body. So during the post-transplant period, there are immediate post-transplant imaging assessments that we actually carry out. And Doppler ultrasound of the allograft kidney. The allograft kidney is the new kidney. We are going to assess for the perfusion of blood into the new kidney. So the Doppler ultrasound will actually help us see whether there is adequate perfusion within that. Then our 1.5 Tesla MRI is going to be used to check whether there is any blood collection around the allograft kidney, or whether there's any urine collection, any small amount of urine collection within the allograft kidney. And also it assesses the renal parenchyma to check whether there is preserved architecture between the cortex and the medulla during this post-transplant period. So I assure you that there will not be any problem and everything will move on fine.
Good day, my name is Dr. Martin Igbokwe. I am a urologist and kidney transplant surgeon with Zenith Medical and Kidney Center here in Abuja. At Zenith Medical and Kidney Center in Abuja, our passion is to offer kidney transplant surgery to our patients and to give them a fantastic outcome. Kidney transplant surgery in our hospital is performed by highly skilled and seasoned expert surgeons. Our main goal is a successful surgical procedure to both the donors and the recipient. We operate in an international standard twin theater with the donor surgery going on one side and the recipient surgery going on simultaneously at the other side. Our theater is equipped with state-of-the-art tools, giving us fantastic outcome. We operate under sterile and organism-free environment, and we also operate using strict COVID-19 protocols, ensuring that all the surgical patients coming in and the theater staff are screened for COVID-19. The kidney donors and the recipients are first seen in our outpatient clinic, where we want to identify any potential surgical risk and also to confirm their fitness for surgery. The surgery for kidney donors is called a simple nephrectomy, and it's performed using a mini donor incision on the flank in an extraperitoneal fashion. Our patients usually stay for the surgery in 1.5 to 2 hours. After the surgery, they wake up with a catheter through their penis, with which we monitor their urine for 24 hours, and our patients are usually discharged on the 3rd day of surgery. Complications like hemorrhage, which I mean bleeding, wound infections and flank bulge are rarely observed in our donors, and generally our donors have fantastic outcome after surgery. For the kidney transplant surgery in the recipients, this is performed using a lower abdominal incision, which is called the Gibson's incision. This surgery also takes about 2.5 hours. It involves meticulous dissection and anastomosis of the new kidney into the recipient, and is a very highly skilled vascular surgery. This is done usually in 2 hours in our practice, and our patients also have very good outcome. Complications that can arise after this surgery include things like acute tubular necrosis and delayed graft function, in which case there is a little bit of delay in production of urine by the kidney. There are also forms of rejection of the kidney which can happen, bleeding and thrombosis. I must tell you that these occur in about 5 to 10% of the patients that we operate, and when they do happen, we follow them and manage them up following international protocols. Our patients come with fantastic outcome. On the whole, we've performed hundreds of this kind of operation for the teeming number of Nigerians with kidney failure, and the general consensus from our patients is that they have a very good and excellent outcome. They will recommend anybody to come here. So in Zenith Medical and Kidney Center, the surgical unit is here to meet your needs, here to give you the best and give you satisfactory outcome. Thank you.
Yeah, at ZMKC, it's our utmost priority to ensure that donors remain healthy even after donating a kidney. And after their surgery, the initial care is usually at the high dependency unit, where they are monitored closely. This usually takes about 24 hours, and they usually have adequate pain control. And this is usually done by the anesthesiologist. The second day after surgery, they usually commence their oral intake, and they're able to move around, and we commence them on breathing exercises, which we call eccentric spirometry. And on this second day after surgery, we usually get their catheter removed so that they'll be free to move around. On the third day after surgery, we open the wound dressing so as to enable us to look at the wound. After then, we maintain them on open wound dressing. And interestingly, they are discharged on third day after surgery. They are expected to come back for follow-up on the 6th after surgery, during which we look at the wound to be sure that there is no surgical site infection around the wound, any discharge, and also re-counsel them on need for healthy lifestyle. They are asked to come back on the 10th day after surgery. And on this 10th day when they come, basically we take out the sutures, and at that time they are advised again on how to live a healthy lifestyle and discharged from the clinic. So basically, donor care after surgery is within 10 days, and they'll be off to their normal daily activities.
Kidney transplantation is the best form of treatment for persons with end-stage kidney disease. However, kidney transplantation is just the beginning of a journey to a near normal life for somebody who has had the procedure. Why do I have to say this? It's because understanding of proper kidney transplantation care is the key to achieving the goal of living a near normal life. For the purpose of this discussion, I will divide into 3 segments, post-kidney transplant care, to 3 parts. The first part is immediate care, the second part is the short-term care, and the third one, which is the last one, is the long-term care. Now, for immediate kidney transplantation care, which takes between the first 2 months after the person has had the surgery done. Of course, in Zenith Medical and Kidney Center, the first 1 week, the patient is expected to be in intensive care unit where proper vital signs, urine output, to know how the new kidney is functioning very well. After 1 week, the patient is discharged to the ward. Usually in our center by our protocol, if there is no problem, the new kidney is making urine, the results are fine, the blood workup are fine, the patient is expected to go home 2 weeks after the procedure. But usually for us, we don't want the patient just to leave town. We have a very good and standard guest house where we want the patient to go and stay at least for the next 6 to 8 weeks. Why do we want the person to be around? For 2 reasons. One, the guest house is just about 5 minutes drive to the hospital in case of any emergency. You have a 24 hours car services that you can always call upon
and they will respond to bring the person down to the hospital. Also, after the person has been discharged for 2 weeks, we expect to be seeing the person once or twice in a week, where you come for the clinic follow-up. During the clinic follow-up, physical examinations, we take your urine, we take your blood to check for some workup in it. We know in this period of this immediate short-term care that I'm talking about, the tendency to have infection is very high, and those are the things that we are watching out for in taking your urine and in taking the blood of the patient that do this. Don't forget, you are having a new organ in your system, and your body natural response is to want to fight, to want to destroy that organ. So we are already giving you drugs and medication to prevent the new kidney being rejected. And as a result of that, we need to monitor the drug that we are giving you. Also, during the clinic follow-up, we ask for any complaint that you are having. We ask for any drug side effect that you may be having. And most importantly, we also want to be sure that you are taking the medication as prescribed for you. For the short-term care, this one is between 2 months to 1 year. And during this period, your clinic attendance will definitely reduce. We'll be seeing you twice or once in a month, depending on how you are responding to the treatment. During this period, there are some medication that we would like to stop also by 3 months or by 6 months. They will also want to check your drug level, particularly tacrolimus level, to be sure that it is not too low and it is not too high. And the last aspect of it, which is the long-term care, and this has to do with treatment, anything that happened after 1 year of having kidney transplant. Like I said initially, your clinic follow-up will also reduce. You'll be attending clinic maybe twice, or maybe every 2 months or every 3 months as the occasion demands. Most of the patients also ask that when can they start to work? Usually we recommend maybe 3 months, 6 months, you can resume work back, but not starting at full capacity. You can be going to work maybe alternate days, you can be working from home. Then for those that are not living within Abuja, where the hospital is located, they want to travel back to where they are. You need to see your nephrologist to plan particularly for your drugs. You need to get drugs that can last you as much as possible. And lastly, is drug adherence. We can't overemphasize this because most patients, by the time they've done transplant 1 year, 2 years, they look like any other normal human being. And the tendency for them to think that they don't really need the drug. Some may even start reducing the dose of the drug. The danger is very high. For you to have a long-lasting kidney in your system, you must be compliant with your drug.
Hi, my name is Pharmacist Stephanie, and I'll be giving you some key information about your medications post-transplant. So the first thing you need to understand is you'll be taking a cocktail of medications post-surgery, ranging from immunosuppressants, antibiotics, antivirals, and others in order to prevent rejection. So please adhere to your prescription and take them diligently. We at Zenith Medical and Kidney Center have the best quality of medicines available and are very capable of getting these medications across to you anywhere you are, within or outside the country. Secondly, I would like to advise post-transplant patients to avoid getting inferior or substandard drugs from unknown sources who claim to have more affordable alternatives, because over the past years, we've had cases of our patients coming down with certain issues affiliated with drug therapy problems and adverse drug events. There are quite a lot of drugs out there that contain elements that can render them contaminated, either through inadequate storage facilities or handling. In order to avoid that, we have partnered directly with major pharmaceutical companies such as Roche, Sandoz, and other leading multinational companies who provide medications at the best possible prices while eliminating the middleman cost and also providing surety that medications are accessible and produced under good manufacturing practices. Lastly, I would like to say that we are always available to answer any questions you may have regarding your medications post-transplant. We run a 24-hour pharmacy, and there's always a pharmacist available for medication reconciliation, providing pharmaceutical care, and answering any drug-related questions you may have.
My name is Barrister Ibrahim Yusuf. I am the Company Secretary, Hospital Secretary and Legal Advisor to Zenith Medical and Kidney Center. Here at Zenith Medical and Kidney Center, we pride ourselves in top-notch healthcare service delivery to our patients. And Zenith Medical and Kidney Center, being a tertiary health organization or institution as it is, we are regulated by quite a number of agencies, laws, and policies. One of those laws is the National Health Act, which is the prime legislation, federal legislation for healthcare providers in Nigeria. Now, kidney transplant is a healthcare service that requires organ donation from a donor to a recipient. Therefore, it falls within the ambit of the regulations of the National Health Act. The National Health Act spells its do's and its don'ts as regards organ transplantation in Nigeria. And as a healthcare institution, we are both obliged and fully committed to ensuring that we follow these stipulations to the letter. Now, as a medical and kidney center, we have a transplant workup checklist. And if you go down that checklist, you'll find yourself at the legal unit. Here at the legal unit, you have to start your legal documentation process, and it is divided into 2 bits, which is the financial and the legal. Now, what is expected of you financially is at the point of the transplant, or at the point of which when you are starting your legal documentation, you should have made all payments relating to your transplant process here at the Medical and Kidney Center. Now, when that is done, we can fully switch to the legal part of your documentation, whereby it will be expected that you fill some documents with us, some consent forms, and some affidavits. Now, our process here requires that both the donor, the recipient, and his or her donor comes with a family member, in which case we'll be requiring certain documents from all 3 persons. Now, for the donor, it's expected that the donor comes here with 6 passport photographs, a valid ID card, and we have to note the fact that the donor is the targeted person in this documentation process, because it's important to ascertain that the donor is being donated to the recipient of his own or own free volition, without any duress or undue influence from the side of the recipient or any other third party. Now, we also require the donor to come with a family member of his or of hers, who will also be asked to produce a valid ID card and a passport photograph. Now, the recipient, who is our patient and who is recognized by the hospital, will also need to produce some documentation as well. The recipient will fill out the affidavit of consent form together with the donor, and also produce 5 passport photographs and a valid ID card. The recipient is also required to fill a form known as the Durable Power of Attorney for Healthcare, in which case the recipient appoints an advocate who can take decisions on his or her behalf in any event that he or she is unable to do so by herself. Now, having filled all your consent forms, it is expected that all those forms will be notarized by a competent notary public or a court of law. And when that is done, you return them back to the hospital to keep in your records as your legal documentation. When you have fulfilled all these legal requirements, the legal department will issue you a legal clearance form, in which you present to the transplant team on the day of your transplant. Now, it's important to note that for purpose of preference, and also in line with corporate and legal standards, we accept valid ID cards, and by valid ID cards we mean any card that is generally acceptable by the financial institutions like the banks, or by any government agency, to properly identify and verify the persons presenting themselves before us for transplant. We also like to point out the fact that family member and family donors are highly recommended for this process. This is because it avails us the ease of legal documentation, certainty, verification, and consent. Now, we also like to point out the fact that without your legal documentation fully done, your transplant will not be taking place. So we advise that you comply with all our policies, all our regulations, and we wish you all the best here at Medical and Kidney Center. Thank you.
Hi, my name is Martha, and I'm a certified dietitian here at Zenith Medical and Kidney Center. So today I'll be talking about your dietary management. Adequate nutrition is important before and after your transplant surgery. A good nutritional intake before your surgery will help you heal quicker after your surgery, while a poor nutritional intake before your surgery may slow down your recovery and affect the outcome of your surgery. Therefore, it is important to continue to eat a healthy and balanced diet while you await your surgery. The dietary unit here at Zenith Medical and Kidney Center will provide you with adequate nutrition education before your surgery, so you have all that you need to know. So what are the things you need to know after your surgery? After a kidney transplant, your diet still plays a big role in managing your health. Adequate nutrition will reduce your risk of infection and graft rejection. During this period, your body has a greater need for calories and protein. So you have to choose foods that are high in protein, such as milk, fish, chicken, eggs, and other poultries. Ensure you eat a variety of food and watch your portion. When you don't have an appetite, you can consume 4 to 5 small meals daily so that even while you don't have an appetite, you are not lacking anything. Half of your plate needs to be filled with vegetables and fruits. The more the vegetables and the greater the variety, the better for you. So eat colored vegetables such as greens, carrots, and tomatoes. Eat whole grains like oats and brown rice. And ensure you look out for products that say 100% whole grain or whole fiber when you're shopping for food. The dietary unit here at Zenith Medical and Kidney Center will be in charge of providing you with adequate nutrition so you don't have to worry about anything at all. We have it right under control. After you are discharged, ensure you see a dietitian for the long-term management of your nutrition status so that you can adequately manage the health complications that comes with taking your immunosuppressants. Some of these complications include high blood sugar levels, high blood lipid levels, and bone loss. It may be challenging to make good nutrition decisions at first, but we are here to guide you. Here at Zenith Medical and Kidney Center, we want our patients to enjoy their new organs by practicing a healthy lifestyle in order to get the full potential of their second chance at life.
For the anesthetic part of the management of these patients, patients will be seen in the pre-anesthesia clinic, that is before the surgery. And this is done weeks before the surgery, where we want to see that the patient is fit and optimized for the surgery and for anesthesia. We review their investigations, and if they have some comorbidities, they may need to do additional investigations, and instructions are given to these patients, and any questions that they have is addressed. And the modalities for anesthesia is explained to the patient. The surgery is done under general anesthesia or regional anesthesia. Usually for the donors, we offer general anesthesia, and for the recipients, usually regional anesthesia in form of a combined spinal epidural is done. On the day of the surgery, patients are received in theater. The surgeries go on simultaneously, so the donor, on the donor side, we offer general anesthesia, which is a state of controlled unconsciousness, to present a patient that is pain-free and comfortable for the surgery. On the recipient side, the combined spinal epidural is done under aseptic conditions. The advantage of the epidural is it allows us to continue with post-op analgesia after the surgery in the post-operative period. At the end of the surgery, the donor goes to the high dependency unit where they are monitored for at least 24 hours, and the recipients are admitted to the high dependency unit or the intensive care unit, and they are monitored for up to a week. In the post-operative period, we want to ensure adequate fluid balance, prevent hypovolemia, hypotension, and to ensure infection control protocols. Thank you.
My name is Dr. Ipundu Nonso, the consultant pediatrician and pediatric nephrologist. Over the years, we've observed that pediatric renal transplant programs have been on the increase, and Zenith Medical and Kidney Center has not been accepted. Incidentally, that's because of the rising incidence of chronic kidney diseases in children, and we all know that renal transplants in children is one of the therapies available for them. Typical age groups, as we see in children, is between 4 to 14 years, and as is the case in also ZMKC. Incidentally, at ZMKC, we've had over 12 pediatric transplant cases handled in the last couple of years, and I must say so, successfully conducted. Yes, of course, we have unique challenges in children. As we all know, adults and children are not the same thing, but then they get to be sorted out. Typical challenges in children are unique, I will say, because of one, they are young. Because they are young, we have smaller sizes. The adult child discrepancy when it comes to donor recipient size is unique, and that's a big problem. There's also an issue when it comes to adherence to drugs. Children tend to have issues with adhering to their medications, and we all know that immunosuppressive agents are very important drugs in taking care of these children. Of course, we will talk about their higher metabolic needs. They have more energy needs in their growth pattern because, of course, they are still young, they are still growing, and they have need for dietary control and care. A child is significantly needed to be cared for psychosocially, because children that have transplant have psychosocial issues. And those psychosocial issues range from depression to, as could be as extreme as suicidal ideation, because they have need to worry about why are they different, why should they be worried about their drugs, why should they be worried about care and playing with other children. They're always worried about several things, and you need to pay attention to all this. So what do we do in ZMKC that's different, that makes it unique for our center? One, in ZMKC, we pay close attention, very close attention to their dietary and nutritional requirements, and that helps us to ensure that their growth spurt is not hampered, as well as every aspect concerning their metabolic needs. We pay close attention to the drugs, to the drug regimen that they take. Because of their unique age, because of their unique weights, we have to pay attention to the immunosuppressive agents and ensure that these are tightly regulated, tightly managed, and we also ensure that they get the best of care as regards that. We pay very close monitoring to their fluid management in the immediate post-op care as well as the long-term care. That ensures that at all times they are well hydrated, that the kidneys are functioning optimally, while we keep a close eye on the laboratory values of those kidney functions and kidney indices. Of course, I must point out that we offer a multidisciplinary approach to all that we do for them. Here we involve the dietitians, the nephrologists, the transplant nephrologists. We also involve the physiotherapists, because we also know that they are prone to a lot of bone disorders. We involve the psychotherapists when the need arises to address the psychosocial issues. I must point out that in doing all these things, we are trying to pay attention to the fact that this is a child that we're dealing with. And children, because of the long age that they will have to live on earth, we pay attention to the fact that these kidneys must give some time to function optimally, given the durational period they still have to live. So in all sincerity, pediatric transplant program in ZMKC, yes, it's growing just like in other places where it is also growing. But we've had modest successes in all that we've been doing. And I can assure you that here you can get the best of care when it comes to multidisciplinary approach to our patients, and get the best of care when it comes to multidisciplinary approach to their needs, and get the best of care when it comes to multidisciplinary outcomes that we expect for our children.
My name is Fatima Yunus Batula. I was diagnosed of kidney failure in 2019. And I was doing dialysis at a general hospital before I got to know Zenith Medical and Kidney Center. My first dialysis experience with them was so fantabulous, because before I got to the Zenith Medical and Kidney Center, I'm always breathless, swollen, and I couldn't even eat. But the first day I had dialysis, I was like, wow, alhamdulillah, I thank God that I came in contact with them. So I had my kidney transplant in the year 2021, 26th of February. And I thank God I am getting better by the day. I'm improving, like no more breathlessness, no swollen legs or body. I'm always eating, like I can eat 6 times in a day. So, and my experience with the doctors and the nurses was so good, because they really take care of us, especially the AG nurses, always around. Anytime you call them, they don't get tired. Get your drugs on time, and anything, like even when you are sleeping, they wake you up and your time to take drugs. They will even be telling you sorry that I wake you up. I was like, why will you tell me sorry when I'm the one that is sick? But that is their work, and I really appreciate them. I've been recommending Zenith Medical and Kidney Center since when I was in Lagos, because most of my dialysis colleagues that we've been doing dialysis together, when they see how good I'm looking, how strong I am, they ask, Fatima, where are you dialyzing? I say, I'm dialyzing at Zenith Medical and Kidney Center, and their machines are so good, their nurses are so good. And the next day, I'll just go to dialysis and meet them there, that they've already come for dialysis too. And for the transplants, I really recommend everyone that is ready for the transplant. Like, no need of going outside the country to waste more money and where you don't know anybody. Here in Nigeria, we have the Zenith Medical and Kidney Center, where you can have your transplants. Then I appreciate the doctors, the surgeons, and everybody in Zenith Medical and Kidney Center.
Assalamu alaikum, ni ne Inusa baban Fatima wanda take da faman ciwon koda. Alhamdulillahi mun gode wa Allah, mu ma yanzu a ƙasarmu Najeriya ana yi, mun zo Zenith na Abuja an mata aiki. Ni ne babanta, ni ne na bata koda saboda ƙannuwanta ba su kai ba, ni ne na bata koda. Alhamdulillah an mana aiki, jikinta lafiya, jikina lafiya, na yi farin ciki. Mu ma yanzu ba sai mun je kasashen waje ba, sai Indiya ana ta zuwa ana ta fama. Yanzu mu ma Allah ya kawo mana Najeriya, mutanen mu ma suna ta yin wannan aiki. Allah ya ƙara masu fahimta, Allah ka ɗaukaka su, Allah ka ɗaukaka wannan asibiti. Wannan asibiti na Zenith, Allah ya ƙara ɗaukaka shi da ma'aikatansa. Mun gode duk likitocin nan da suka yi fama wannan aiki, an yi a dace, an yi a sa'a. Mun gode musu, Allah ya ƙara ɗaukaka wannan asibiti, Allah ya ƙara ɗaukaka shi. Muna jin daɗi da su. In ka zo ba wani renin wayo, ba wani zaɓe kai wane ne, da ka zo za a karɓe ka hannu biyu, za a yi maka aiki. Alhamdulillah, mun gode Allah, mun gode wa Allah.
My name is Mrs. Victoria Kennedy. I want to appreciate the work of the Almighty God in my life, especially when I was sick. They said that I should do kidney transplant. They said they will change my kidney. They will give me another one. I said, did they do it? They said yes. I said, okay, if they do it and I will not die. He said, Mommy, you will not die. Calm down, you won't die. And I say, okay, if they will do it and I will not die, let them do my own now, so that I will be living a good life now. So they introduced this place to us, that we should come and do our kidney transplant here. And when I came, I see that everything that they tell me about this in the hospital, it was true. And we did the kidney transplant. And you can see me now. I'm now physically okay. Nothing is wrong with me again. No headache today, stomach tomorrow. No more. I'm now perfectly okay. And I want to thank those who are taking care of us, the doctors, the nurse, the cleaner, everybody that is in this hospital. They were every one of them, they were good. Even the driver.
The security men.
They are fantastic.
The option of a transplant seemed like, okay, so let's try. And we got introduced by doctor to Zenith Medical and Kidney Center. We had the option of going through the tests, the matching, and thankfully the relative that came forward was a match. And I can't lie to you, since my mom had the transplant, personally, I've been the sole carer since she was ill. Personally, my life had changed. Like, it changed. I could sleep well. I could go to bed because I know that, oh, she is better now. Her kidney is fixed now, so to say.
My name is Dr. Nsikak Ekwere. I'm one of the kidney transplant coordinators. After everything that had been said, I really want to emphasize that Zenith Medical and Kidney Center has carved for herself a niche in the transplant prowess, a skill and commitment executed by highly trained personnel with a multidisciplinary approach and careful selection and preparation of our patients. So here are 10 important points to note as you prepare to have your kidney transplant with us. 1. As a recipient, your donor must donate his or her kidney out of their own free will without fear or favor. 2. Sampling for recipients and donors will not take place if the donor hasn't been consulted and counseled by the urologist, with the checklist reaffirming it. 3. Recipients will not be admitted until they have fulfilled all obligations on the checklist and their checklist duly signed by all Zenith Medical and Kidney Center transplant team members. 4. Donors must bring a near relative during the legal process of transplant to sign various legal documents, including an affidavit. 5. Recipients are advised to be financially ready after transplant to be able to purchase their medications. 6. Recipients must take their medications as prescribed by their doctor. They are not allowed to stop or adjust the medications on their own without their doctor's recommendation or the risk failure of the transplanted kidney. 7. Recipients should be aware of purchasing fake and unbranded medications and ensure all their kidney medications are gotten from ZMKC pharmacy or an authorized pharmaceutical body after due consultation by the ZMKC pharmacist. 8. Recipients must take their medical follow-up very seriously and report any symptom to their doctor, no matter how mild. 9. Kindly note that the only information you are to adhere to is that of your doctor before, during, and after your transplant. If you are not clear on anything, please ask your doctor. Do not take any advice concerning your transplanted kidney or your general health from just anybody. Finally, a duly signed checklist is inadvertently your visa to get a kidney transplant at Zenith Medical and Kidney Center. It will also interest me to tell you that we see every patient that walks into our facility as a potential testimony and a reference point. So I say, thank you for choosing Zenith Medical and Kidney Center to help you with the treatment option of kidney transplantation. Thank you.